If the tumor is truly too big to be surgically manipulated at all, that would be more of a concern for this dog.
Welcome to Dog Cancer Answers, where we help you help your dog with cancer.
Dr. Brooke Britton, thanks for joining us today.
Thank you for having me.
We have a call from Gio in Pomona, California, so let's go ahead and listen to that.
Calling in because my dog was diagnosed with a mammary tumor. We took her in for x-rays. It hasn't metastasized. It's pretty large, and we took her into the emergency hospital because she had gotten to it. She was biting at it, and then it ruptured, started bleeding. They recommended that it wouldn't be able to get operated on because it's too large. And I'm not sure if we should take her in to get it removed as soon as possible. It is bandaged. It's looking a lot better. It's not bleeding, but I'm not sure really what to do at this point. We did change her diet to more of a keto diet. She was already kind of eating fresh food, but we eliminated all carbs from her diet, and we're just not too sure what we should do. We have an appointment on the 24th to get the surgery, but we're not sure if that's too late. So right now it's January 18th, and about a week until her appointment. Thank you for the opportunity.
So, Dr. Britton, what do you think? Is a week too long to wait for what sounds like a large, bloody mammary mass?
Ideally, that would be addressed as soon as possible, but it depends on, again, the wait times, unfortunately, for getting in to see. I don't know if Gio is seeing his primary vet or a specialist surgeon, but even with general practitioners, the wait times can be up to a week or longer, sometimes much longer, because of the caseload that we're all seeing nowadays. So as soon as possible is ideal, but as long as the tumor looks better, as he said, and relatively stable, a week could be a reasonable time frame to have this tumor seen.
Okay. What do you make of the idea that a tumor is too large, a mammary tumor is too large to remove?
It's hard to say because I'm not seeing this dog myself.
Right.
I'm also not a surgeon, so I'll preface my answer by saying this, but many tumors that may not be obviously apparently resectable at first glance, sometimes with the advent of advanced imaging or with consult with a specialist surgeon who does oncologic surgeries all the time, you may get a difference of opinion as to what is resectable or removable and what is too large to be resected. There are some tumors that are clearly just too large to be removed in their entirety, in which case occasionally we can do what's called a debulking procedure, which is try to take off the bulk of the tumor and at least get it down to a microscopic level of disease. We know we're not going to get a margin on the tumor, meaning a true complete removal. But if the bulk of the tumor can be removed such that this dog can be relatively pain-free after the surgery and not be in a position where she's going to continually bite at the tumor and have the tumor open and bleed, that would be the next best ideal. If we can't get a wide margin, then maybe a narrow margin and at least getting the bulk of the tumor off. If the tumor is truly too big to be surgically manipulated at all, that would be more of a concern for this dog because tumor tissue, once it starts to ulcerate and bleed, it's very difficult to prevent that from happening or stop the bleeding once that happens. And so occasionally we can use other types of treatments, try to shrink the tumor with chemotherapy or sometimes radiation therapy, although the benefit in mammary tumors is not as well established for radiation. The best option here for this dog would likely be surgery if it's possible to at least remove the bulk of the tumor.
Okay, so it's possible that what they were saying, that it was too large. Maybe it's they don't think they can get a wide enough margin. It's taken up so much space, or it's attached itself to other parts of the body that might be important to keep intact, like the muscle wall or something, that they feel it's
too extensive. Some of these tumors, if they're deeply invasive into the muscle or even the body wall, might require reconstructive surgery. And not everyone, understandably, is comfortable with doing that, or has enough experience to know if that's necessary or not. And so, again, it's difficult for me to say truly, is this a resectable tumor or not, without seeing a tumor myself. But the best judge of that is the person who's actually going to do the surgery. And then it's down to their level of experience and whether or not they specifically do oncologic surgeries routinely, to know what they think is feasible. In particular, if it's growing quickly, that would rapidly limit the surgical options the bigger the tumor gets.
And there is a limit to people's skills. Some veterinarians might simply not be comfortable and might feel that they are, if there's an oath of first do no harm, if they feel like their surgical skills are not up to the task, they might be worried that they're actually going to do more harm than good.
Absolutely.
And so they would want someone else to take that on or to evaluate
Absolutely.
it.
The level of surgical training varies a little bit depending upon the school that you go to, or whether or not you've done an internship, for example, and had additional training. But even with an internship, you're really not getting a huge amount of surgical experience in most schools or internships where you're doing a wide variety of surgeries on your own. So many general practitioners, when they're out in practice, if they have an excellent mentor or group of mentors, they may take an interest in surgery, take additional surgical courses. And there are many excellent GP general surgeons who feel very comfortable with a variety of different procedures, and others don't feel as comfortable. So there is a wide range there. With a specialist surgeon, you can be assured that they've at least completed a minimum case log of certain types of procedures to achieve their credentials for their board certification. And in addition, you can do surgical oncology fellowships now. So beyond a traditional surgical residency, you can do oncology-specific surgical fellowships. So there is even that level of training now in our veterinary world, where you have heightened levels of experience with doing increasingly more difficult and complex oncology surgeries. So there's a lot of different surgical options out there and a lot of levels of experience in that regard.
Right. And your general practitioner vet, who you've always gone to for everything else, you might run into this where they're confronted with something they can't personally handle. And so we just have to wait until someone else comes along. And it's always that's stressful to wait, even a week.
Waiting is very stressful. It's very stressful. But the good general practitioner, and there are many excellent GPs out there, will know, just like I would as an oncology specialist or another specialist, an ophthalmologist, for example, know the limits of our abilities with respect to what we feel comfortable with doing, the level of medicine that we can offer in our wheelhouse. Just as, if you went for a general annual physical with your MD physician and you needed, a knee repair, you wouldn't go to your general internist for a knee repair. And so it's the same in veterinary medicine. It doesn't mean that there aren't excellent GPs out there that can't do surgery. There are many GPs that do a wide variety of surgery. And we're, I think, a little broader in that regard than MDs, and to the better. But there are some surgeries that I would put forward. It is better to at least consult with a veterinary surgeon, especially for larger or more extensive tumors where we know there's cancer or potential of cancer, at least to get their opinion before we try a big surgery like that.
So he mentioned that she's biting at it, which tells me that it's probably uncomfortable in some way. It's itching or it's hurting. She's trying to take care of it herself. It sounds like they got that under control. What do you suggest if people have a dog who's biting at their tumor, what is it that you suggest while they wait for that surgery to come through? How do they address that?
It's hard sometimes, especially when they're losing a lot of blood or they're having tumors that ooze constantly. But depending upon where the tumor is, sometimes they can put, it's a little difficult in warmer weather, but they can put a little cotton onesie over the area of the tumor, like a t-shirt or a little leg warmers if it's on a leg, something that's breathable and not constricting. In general, we don't like to cover tumors all the time, or open wounds, as this would be if we can do, because a lot of the wraps, for example, that we can put on them can slip or have friction or be compressive. But sometimes when needs must, you do have to bandage or at least put a light covering over that tumor. And then occasionally we can use medication. Gabapentin or other types of medications can help because it may be that it's uncomfortable or a little painful, and that's why we're licking or chewing at it. And maybe just taking the level of discomfort down and alleviating that pain can cause them to take their mind off of it enough. When needs must, an e-collar, especially I like soft e-collars, are kind of a better quality of life issue, I think, in the meantime, like a little soft flower e-collar or in kind of an inner tube, life preserver style blow up e-collar, so that they're more comfortable, but they're not constantly getting to that area.
Yeah. So really just trying to, and the gabapentin is often used in pain cocktails, but my understanding is it actually just calms the nervous system down. It doesn't directly address pain, but it sort of relieves anxiety. So it can kind of take your mind off things. Am I accurate?
It does have some pain relieving properties, and I like it for tumors that we think have a pins and needles type feeling, or what we would imagine that to be if we were human with that tumor or problem. It's good for bony related tumor pain. And so sometimes just that and that cyclical behavior of once we know it's there and we're chewing and licking and biting at it, we're going to keep doing that. Sometimes those sensations that burning and itching and tingling and stinging sensation that we imagine many of these tumors can have when they start to ulcerate and become irritated, gabapentin can just dull that feeling for them. It is one option in a host of many different pain relieving options that we can look at. Sometimes anti-inflammatories are helpful if there's a lot of swelling and inflammation around a tumor. And those, of course, are all prescription medications, but that's something that a general practitioner can prescribe while we're waiting to see if that's helpful.
Right. And in terms of other things he can do, I mean, obviously there's lots of other things to do to address life quality. But if we've got a tumor and we can surgically remove it, that's generally your priority. Yes?
True. And it's small consolation to the person who's anxiously waiting for an appointment. I realize that. But surgical removal of most solid tumors like this are the best option for these tumors, as long as they are resectable, to his point. If the tumor can't be removed, then there are some palliative measures that we can try to shrink the tumor or take the discomfort away, lessen the bleeding. Although, again, that can be more difficult. Treat infection that the tumors cause secondarily. But surgery is typically the best option where we can perform it.
Right. Well, thank you so much, Dr. Britton.
Thank you.
This show is brought to you by dogcancer.com, where over 40 veterinarians, veterinary oncologists, cancer researchers, and science writers pull together to bring you better information today so you have no regrets tomorrow. We do the research, we talk to the folks in the trenches, and sift through the hype and the anecdotes. That's dogcancer.com. Start your own research at dogcancer.com today so you have no regrets tomorrow.
Thank you for listening to Dog Cancer Answers. If you'd like to connect, please visit our website at dogcancer.com or call our listener line at 808-868-3200. And here's a friendly reminder that you probably already know. This podcast is provided for informational and educational purposes only. It's not meant to take the place of the advice you receive from your dog's veterinarian. Only veterinarians who examine your dog can give you veterinary advice or diagnose your dog's medical condition. Your reliance on the information you hear on this podcast is solely at your own risk. If your dog has a specific health problem, contact your veterinarian. Also, please keep in mind that veterinary information can change rapidly. Therefore, some information may be out of date. Dog Cancer Answers is a presentation of Maui Media in association with Dog Podcast Network.